Good morning, good afternoon, good evening. We'll just get started in a few minutes. We're just waiting for people to come in. Great. Welcome, everybody. My name is Divya Matthew, and I am the Director for Policy and Advocacy at Women Deliver. Thank you for joining us today for a discussion on family planning in a climate crisis, building resilience for women and girls. I would like to thank the host of the event, FP 2030, as well as the institutions represented, the Asian Pacific Resource and Research Center for Women, ARROW, the Government of Burkina Faso, the Foreign Wealth Commonwealth and Development Office, FCDO, within the Government of the United Kingdom, the United Nations Population Fund, UNFPA, and Women Deliver. Before we start, I just wanted to go over a few housekeeping matters. First, to note that the webinar is being recorded. We will have simultaneous interpretation available in English, French, and Spanish. So if you can please click on the globe or the interpretation icon at the bottom of your screen and select the language of your choice. We welcome questions from you, the audience. So please list your questions either in the chat function or the Q&A functions. Please also be mindful of engaging in a respectful manner so that everybody can have a good experience while engaging online. For any technical difficulties, please contact Sophia Hefferman and Onye Ide at FP 2030. Sophie and Onye, if you can please put your emails in the chat. Thank you. So this event is taking place in the margins of the 66th annual session on the Commission of the Status of Women, or CSW 66. It is the UN's largest gathering on gender equality and the empowerment of women. And this year's theme focuses on achieving gender equality and the empowerment of girls and women in the context of climate change, environmental, and disaster risk reduction policies and programs. So the goal of this session is to leverage CSW 66 to move the conversation forward on the links between climate change and action, gender equality, and sexual and reproductive health and rights, or SRHR, including family planning. We'll be launching FP 2030's Emergency Preparedness and Response Strategy, and we'd also like to engage diverse stakeholders, including women's rights organizations, who are working towards realizing gender equality to make FP 2030 commitments and strengthen collective action to protect SRHR, including family planning for populations affected by climate change disasters, but also the COVID-19 pandemic and other types of crises. In terms of the agenda, for the next 90 minutes or so, we'll be having welcome remarks by Honorable Meresini Rakuita, the chair of the FP 2030 Governing Board, followed by a panel discussion with some time for question and answers, and then an exciting on-air conversation segment and the launch of FP 2030's Emergency Preparedness and Response Strategy. This will be followed by closing remarks by Mr. Chris Carter, who's the head of the Human Development Department within FCDO. I'd now like to welcome Honorable Meresini Rakuita to provide some opening remarks.
Thank you, Divya. Good morning, good afternoon, and good evening. As Divya said, I am Meresini Rakuita, Principal Strategic Lead for Pacific Women Lead Program in the Pacific Community and Chair of the Governing Board of FP 2030. As a citizen from an island nation in the Pacific, I'm keenly aware of the dangers climate change poses to nations and communities. I'm also aware of how women particularly, whether as farmers or fishers, girls taken out of school, or mothers feeding their families, face particular impacts of climate change and natural disasters that must be addressed in any climate solution and emergency plan. Too often, however, these impacts are overlooked when national disaster plans are being made. More than 54 million women and girls are currently displaced from their homes and living in humanitarian settings. Even now, it is estimated that 3 million people have fled their homes in Ukraine. And as the effects of global climate change and related weather disasters increase in intensity, the number of displaced people will grow. Whether they are in Poland or Mozambique as displaced people, or whether they are in small island developing states facing the wrath of climate change due to sea level rise or intense cyclones, they need access to health care, and that includes family planning. In 2017, FP 2030 recognized that for many countries, commitments to increase the use of family planning could be easily disrupted in the face of a humanitarian crisis if it wasn't included in national emergency preparedness plans. Since then, we have worked with governments to include emergency preparedness in their FP 2020 commitments. Although 71% of FP 2020 focus countries were at high risk of humanitarian disaster, only 23% of FP 2020 commitments included elements centered on emergency preparedness and response. Now, as FP 2030, we are heartened to see that more than half of commitments to this renewed partnership include such language. But committing to action is only the beginning. We must work alongside national governments to ensure they're able to deliver on these goals, and our partners in civil society must hold them accountable and build on their progress. We must continue to partner with young people who may be at increased risk of sexual violence and early marriage in a humanitarian crisis, and have a greater need for family planning, but are doubly at risk of being sidelined in their care as they're both young and displaced from their homes. The conversations we have today and in this year's Commission meeting must not be the last. First, we will hear from several people working at the intersection of family planning and climate change, and then we will share for the first time the new FP 2030 Emergency Preparedness and Response Strategy, which will detail how the FP 2030 Global Support Network will continue our work in this space. This work is more important now than ever, as we see more severe weather disasters worldwide. The world struggles to recover from a global pandemic, and political conflict continues to escalate in many parts of the world. Thank you for joining us in this conversation. Now let's get started.
Thank you, Ms. Rakita, for your opening remarks. Thank you for your leadership for many years in the Pacific on advancing gender equality, but also your leadership with FP 2030 in ensuring that commitments have elements centered on disaster and emergency preparedness and response. Your call to action is clear that commitments are just the beginning. What's equally important is implementation and accountability, especially from civil society, and that we must continue to partner with young people in humanitarian crises who are at increased risk of being sidelined in their care as they're both young and displaced from their homes. I'd now like to turn to the panel discussion to expand on some of the themes that Ms. Rakita has stated, but just for some context setting. So the vital role of SRHR for climate action has not really been given the prominence it needs, despite increasing and compelling evidence and discourse. Too often the topic has been avoided because of historically challenging negative associations between family planning and population growth as a climate mitigation strategy. But even beyond this narrative, the importance has not been underscored when it comes to national climate policies and programs. According to a 2021 review of Nationally Determined Contributions, or NDCs, by UNFPA and Queen Mary University, we found only 6 out of 50 NDCs include references to aspects of SRHR. Similarly, in a Women Deliver and International Institute for Sustainability, Sustainable Development 2021 review of national adaptation plans, while we found that health had been prioritized, very few NAPs touch on SRHR. But we're seeing the dialogue evolve in recent times. Advocates are calling for a conversation and action within a social justice framework and a human rights-based approach. We've also seen advocacy increase in this space. Just one example is the SRHR and Climate Justice Coalition, which is a global network of more than 60 civil society organizations across the women's rights, climate, and health and SRHR spaces, who are committed to collective action and coordinated advocacy to advance SRHR and gender equality in the context of climate change. Inroads were particularly made at COP26 on these issues, and now we're seeing CSW as a welcome space to discuss this. We've had numerous events touching on different aspects, whether be it women's leadership on these interlinkages, to upholding democracy, to intergenerational implications. We're also seeing references made to SRHR and the interlinkages in the current draft of the agreed conclusions, which is the political declaration that comes out of CSW. So how can we maintain momentum and accelerate progress towards COP27 and through 2030? We have a distinguished panel composed of representatives from women's rights organizations, multilateral organizations, and governments to tell us just how. For details on their bios, please go to FP 2030 website, but just by way of quick introductions, we have Biplapu Sheshta, or Bipu, who's the program director at Arrow. We have Dr. Gifty Adiko, who's the chief of the Commodity Security Branch at the Technical Division within UNFPA. And we have Ms. Ufazi Ajami Bari, who is the coordinator of the Sexual and Reproductive Health Program within the government of Burkina Faso. So I'll turn to Bipu now, if you can turn on your camera.
I'm here.
Great. So Arrow is a FP 2030 commitment maker and who has been working on the interlinkages between climate change and SRHR for many years, including when it comes to evidence generation, advocacy, as well as capacity strengthening. And so from your experience in Asia, what are some of the ways in which climate change has disrupted social movements around access to SRHR, as well as achieving gender?
Thank you, Divya. First of all, I'm truly honored to be on this panel. I think I'll start by saying something that everyone knows now, that climate change is not a gender neutral phenomenon. But it has not been reflected in the policies, plans, and also in the ongoing CSW 66 negotiations that, it's been a difficult negotiations to include SRHR in its entirety. So the 4 parameters of justice, equity, access, participation, rights are deeply skewed against women and girls during climate change. Equity to claim resources is hampered, access to education and health services and other social services is compromised, women's participation in decision-making is not fully realized, and across all countries, women and girls have not been granted our full rights. And as such, the institutions and structures of society are still underpinned by patriarchal norms. And these are reflected in women and girls' access to sexual and reproductive health and rights in the context of climate change. And this challenge is systemic and it's structural. And it's the most marginalized women and girls who are impacted the most. And this is worse in the region like Asia that is at the forefront of experiencing the impact of climate change related disasters. And according to the IPCC 2022 report, which was just released, the vulnerability is higher in locations with poverty, governance challenges, and limited access to basic services and resources, violent conflict, high levels of climate-sensitive livelihoods. And this is all the region, Asia as well. So in regards to the disruption on access to SRHR and gender equality, Arrow has done scoping studies in many countries in the region. And what we have found is that when vital infrastructures such as highways are disintegrated by extreme weather events, especially with floods and landslides, the access to SR services are obstructed, leading to negative SRH outcomes. There are also reduced and unavailable services in areas affected by climate-related disasters. That means access to services like contraception, safe abortion care, and STI testing and treatment is blocked. And these services are not prioritized in the emergency responses. And for girls and women who are displaced and living in humanitarian settings, lack of access to SRH services is the leading cause of death. So the effects of climate change are also an indirect driver of early forced and child marriage. When extreme weather events destroy livelihoods, the financial distress of local communities and families can lead them to consider marrying children as a coping strategy. And we have observed this even in countries where child marriage is banned. And child marriage increases the risk of early pregnancy, which makes the girls more susceptible to placental tears, obstruction at the time of delivery, leading to maternal mortality. And similarly, the increasing workload in the household and economic hardship experienced by the family would also cause parents to withdraw their daughters from school so that they could either help out at the home or find a job to supplement the household's income. And this in turn limits their access to information, including comprehensive sexuality education, hindering their empowerment. So evidences have also shown that the climate crisis increases the incidence of sexual and gender-based violence with access to no or insufficient redress. And in terms of the policy and decision making, what our studies have found is that policy landscape on gender, climate change, and disaster risk reduction, it's very diverse. And they're quite focused on the top-down approach of driving gender responsive action. And in national policy frameworks, key gender specific issues such as sexual and reproductive health and rights, disability, and SGBV they get skipped very easily from planning processes and often have to be traded off with competing priorities. So just to conclude, it's the structural inequalities that are exacerbated, and universal access to sexual and reproductive health and rights becomes even more challenging in the context of climate change, because SRHR is already least prioritized in many countries and in many contexts, even before the onset of disaster. And I'll stop there, Divya.
Thank you, Bipo. You've laid out various aspects of how climate change has disrupted and SRHR and gender equality in the space of equity, rights, and justice, but also a range of SRHR aspects from causing early forced and child marriage to reducing access to CSC to increase gender-based violence. Thank you. And so now we've seen some of the impacts of climate change on SRHR. Let's explore the reverse causality. To GIFTI, UNFP is the UN Agency for Sexual and Reproductive Health and Rights, and it's working with governments and other partners to support adaptation responses to climate change and to put girls and women at the center of these efforts. And so through your work, maybe you can share some of the benefits of recognizing and realizing SRHR as a justification for climate action.
Thank you. Thank you, dear, for the opportunity to be part of this discussion. Thank you for the question. I want to encourage us all to think not just about the benefits of action, but what are the consequences of inaction. I believe we are all here because we believe strongly that women and girls deserve full agency and autonomy. And we all know that sexual and reproductive health and rights, and especially family planning, is a critical lever for women and girls to be able to live the lives they want and realize this autonomy. Yet climate change is causing irreversible and disproportionate harm to women, as we just heard. In many cases, they are plunged into poverty, forced from their homes, experience gender-based violence, and lose access to essential healthcare, including sexual and reproductive health and rights. And this is not just affecting women, but their children as well. And this devastation is destroying families and communities and robbing women and children of a chance for security or prosperity. And if we do not do everything in our power to reach them, imagine all the squandered potential. A generation of girls that would never know what it means to be able to remain in school, pursue a career, and follow wherever their dreams may lead them. We must therefore take decisive action to ensure that women and girls who are living in areas affected by climate crisis do not lose access to sexual and reproductive health, including family planning. If we succeed, we will help ensure that they are empowered, resilient, and better able to cope and adapt to the inevitable changes all around them caused by climate disasters. We cannot afford to fail them. And so disaster risk reduction strategies and anticipatory actions that are inclusive of sexual and reproductive health and rights will ensure that systems will prioritize these needs to mitigate against the impacts of these exogenous shocks. National climate commitments and policies must be gender responsive and inclusive of sexual and reproductive health and rights and gender-based violence, as well as the governance mechanisms that support their budgeted implementation. Finally, sustained and ongoing investment is needed in national data that supports the evidence base on the impact of climate change on sexual and reproductive health and rights to ensure that the right support is provided in the most vulnerable communities and regions. In UNFPA's new strategic plan for 2022 to 2025, we have integrated our value proposition on climate change. And this puts forward a multi-pronged program of action to strengthen resilience to climate change. This includes mainstreaming resilience, prevention, preparedness, and early action, and emphasizing the linkages between humanitarian and development interventions, supporting climate adaptive responses. And this is part of our work, including in our response to crises such as the global COVID-19 pandemic, Afghanistan, northern Ethiopia, Ukraine, and refugee outflow countries, Yemen, as well as other complex crises going on, such that we are able to meet the needs of women and girls. Ladies and gentlemen, we must challenge ourselves to seek out solutions that will meet immediate needs of populations in crisis, whilst also ensuring sustained investments that focus on the systemic causes of vulnerability, such as poverty and inequality. An investment in healthy and empowered women and girls is a clear accelerator to build individual and community level resilience and achieve climate adaptation. When all these are advanced as part of an integrated platform of gender responsive policies and financing mechanisms, upholding sexual and reproductive health and rights can be a game changer for countries that are affected by climate crisis and a true lifesaver for the women and girls who are experiencing the worst effects. This is part of our accountability to the people we serve. Thank you again for this opportunity.
Thank you, Dr. Adiko. I really like that we should frame this conversation not just on the benefits, but on the consequences of inaction. And thank you for laying out some of your suggestions on how to go forward, and whether that's incorporating SRHR as part of DRR strategies or investment in data and research, and look forward to the implementation of your value proposition approach. I'd like to now turn to how does one act on these interlinkages when it comes to design and implementation of national policies and programs. As Ms. Meresini Rakwita mentioned in her opening remarks, since 2017, FP 2030 has cultivated a strong network of partners to advance emergency preparedness and response across the humanitarian and development nexus at both the global and the national level. One partner is Burkina Faso. And Dr. Ajami Barry, I'd love to hear more about Burkina Faso's new 2030 commitment, which includes strategies for making quality reproductive health and family planning information and services available and accessible for populations affected by humanitarian crises. How will Burkina Faso become better prepared to respond, and how will the society be included in prepared efforts?
Merci beaucoup, Divya.
Thank you very much, Divya. Good morning, everybody. And yes, indeed, as everybody has been saying so far, in Burkina Faso, our health system is facing many challenges and crises, not only security crises and intercommunity conflicts, but also natural catastrophes. And we have had large numbers of people who have been displaced. And of course, this means that we have to have concerted action in order to make sure we can protect sexual and sexual and reproductive rights. And in order to do this, these very severe security crises have had consequences. Some health establishments have had to close, and health clinics have had to close. And also there are a large number of displaced persons. More than 1.5 million people are internally displaced, and 52% of these are women. So this just to highlight that women are extremely vulnerable. And of course, we are trying to develop strategies to be able to respond to these humanitarian crises. And our main strategies are to, first of all, have a baseline assessment and to see how we can integrate this into new areas of concentration. We are looking to see how we can look at these areas where there is a large concentration of people to make sure that we can get materials, medical supplies to them and equipment, and also sexual and reproductive health products to them, and that they can be provided free of charge to the IDPs in these areas. We are also looking at how we can develop more advanced strategies. For example, looking at how we can better distribute tasks among the different health centers and work at the community level to make sure that vulnerable populations are being served, in particular young people, women, and people with disabilities. And so we are trying to recruit more community health workers and this will enable us to be able to distribute the tasks more amongst more actors and be able to really strengthen the abilities of local health clinics to be able to provide these services and to provide a more integrated services. Also in our national disaster and emergency response plan, we are trying to develop advanced mobile strategies that will allow us to create mobile on-site health clinics according to the needs, so that we can deal with the needs of these large pockets of displaced persons. And in these areas, we have to be able to get the health services to the vulnerable populations in sort of a mobile health service. And so we are looking at all strategies that we can adopt in order to ensure that people have access to health, and particularly to sexual and reproductive health products. Thank you.
Thank you. You really laid out a holistic view on how to go about, from doing baseline assessments to ensuring that medical supplies are given, especially free of charge, to IDPs, but also looking at national level disaster response. How do you advance strategies and mobilize quick adaptive health connect? Thank you. Just a reminder before we get to the next round, we are accepting question and answers, so please do add to the chat and we will have some time for any. And so I'd like to do a round robin for the panel and focus on some of the key takeaways. So what might be some priorities for action at the intersection of SRHR, climate, emergency preparedness, resilience, that need to happen over the next 5 years? Maybe we could mix it up and start with Dr. Adigo.
Thank you, Dia. Given projections that climate change will double humanitarian needs by 2030, and the devastating impacts we are seeing on women and girls, the nexus between gender, sexual reproductive health and rights, and climate change cannot be an afterthought. It must be central to our social, economic, and political policies. Through our strategic plan, as I mentioned earlier, we are focused on protecting and promoting the rights and inclusive participation of women, adolescents, and youth as agents of change. And we see this as a necessary path to realizing reproductive rights and the UNFPA's 3 transformative results on ending preventable maternal deaths, ending unmet need for family planning, and ending gender-based violence and harmful practices. And so it's important that women and girls are at the center of this response. And we can do 3 things. We can do these things in 3 important ways. First, we need disaggregated population health and gender data to inform climate-related vulnerability assessments and actions, including on the impact on sexual and reproductive health. Second, we must work across all the silos to engage other sectors to meet the complex challenges. And we can achieve this by designing integrated programs that are right-based, community-owned and led, and designed to respond to multiple challenges simultaneously. And also, thirdly, these interventions should be encompassed in national disaster reduction and contingency plans so that we can protect and uphold these when crisis hits. As humanitarian needs grow, these measures will only become more important as basic building blocks towards resilience and emergency preparedness. And in doing this, as UNFPA, we advocate for and leverage the systemic implementation of the updated minimum initial services package, which positions family planning as a life-saving intervention. And with regards to protracted and surgical shocks, we are doing some work with the South Africa development community to ensure that sexual reproductive health and gender-based violence are institutionalized in vulnerability assessment processes. And then, as that was mentioned earlier, the review that we did with Queen Mary University revealed that sexual and reproductive health is not well reflected in climate change policy and action. And so it's imperative that we see more substantial and meaningful recognition of this intersection. And so we call on the major climate-related vertical funds and other financing mechanisms to recognize the central role that women and girls must take in leading gender-responsive climate action. Their full contribution rests on the upholding of their sexual and reproductive health and rights, including their right to live free from violence and harmful practices. Inaction on these issues is not an option. The cost is simply too high. And we must push for accelerated progress in this, because failure to make sufficient progress will have unjust and unconscionable effects on the lives and future of the most vulnerable women, adolescents, and youth, especially adolescent girls. Thank you.
Thank you. It was really important perspectives. Not only that women and girls should be leading this agenda, but also ensuring that their needs are centered to everything. And you've spoken to the importance of the minimal initial services packages in the times of crises to ensure that reproductive health care is continued. I'll turn it over to Dr. Ajami Barry, please, for your perspectives on some of the priorities to take forward. Dr. Barry.
Yes, thank you very much. I wasn't hearing you. So for this question, we insist on, well, given the breadth of the problem and given that our country is subject to these multiple crises, we really emphasize involving civil society at the community level, at all levels. When there is a community mechanism that makes it possible to monitor these commitments and really enables civil society to contribute to building and preparing for any crisis situation. I said we have several, also contributing to the response and resilience. For this, in addition to involving civil society, there need to be policies and practices at the organizational and ecological level that are lasting. There needs to be assistance provided to countries or to lower income countries. There needs to be a connection between sexual and reproductive health and the climate crisis. This is in our countries when we have times where the temperature is very high, we have a lot of children and births that come early, or children that are lost. So this needs to be a multi-sector approach so that we can be prepared to respond to these crises. We need to increase engagements with government and non-governmental actors so that a priority be given to family planning and sexual and reproductive rights for women, girls, and young people. We need to combine these strategies with different sources of financing so that we can promote these integrated approaches and really have resilience with reproductive rights, the rights of young people, and the climate crisis. Thank you so much.
Thank you, Dr. Jami. I think the one thing that was really interesting also in your FP 2030 commitment is that the commitment is from the highest level, where the institutional family planning is under the auspices of the president of the Burkina Faso, by promoting multi-sector coordination between the ministries. And you speak to the breaking down the silos between the humanitarian and development parts of planning and programming. Bipu, please, your turn on what might be some of the priorities for action at the intersection of SRHR, climate and emergency preparedness and resilience that needs to happen over the next 5 years.
Thank you again, Divya. I just want to say that I agree with both the speakers before me. I will share my screen to just share a framework that just is. So I just wanted to share this framework adopted by Arrow and our partner, the Path Foundation Philippines, that shows the nexus between people, health, environment, and climate change. And in the Philippines, coastal women are most at risk of the impact of disasters. And the main threats and factors related to people's health and climate change and the implications contribute to inequities in wealth, status, and exacerbate the burden on women. So what needs is the opportunities for remediation to achieve resiliency to climate change include provision of an integrated package that addresses lack of stable livelihood opportunities, lack of health and SRH seeking behaviors and services, and lack of women participation in conservation management as well as governance. So addressing these women's concerns in an integrated fashion can lighten their burden, improve and highlight recognitions of their role in helping the community achieve the desired outcome, and improve and highlight and also desired outcome of the climate change resiliency. So just stop sharing and start my video. Just give me 1 second. So with that, what we are really looking at is the addressing structural inequalities, which is the key way forward, and it should be the immediate priority to advance SRHR. Gender equality interventions must also address the structural barriers that are embedded in our norms, laws, and policies that contribute to inequality and injustice. That's why we need this climate justice framework, which is very, very crucial for sustainable solutions. This will also be in supporting bodily autonomy by removing legal and policy barriers to exercise sexual and reproductive health and rights. And this also means ensuring enforcement of laws and policies that protect voluntary access to contraception, abortion, and other services. The priority should also be on climate resilient health systems that are more likely to support and ensure SRH services in times of crisis or disaster. We therefore need strong, accessible, and resilient health systems that serve the specific SRH needs of all women and girls and gender diverse people, whether for contraception, antenatal care, safe abortion that are required to fulfill the right to health and to build adaptive capacity and strengthen resilience to direct and indirect climate impacts. So it is also important to link comprehensive sexuality education with youth-friendly SRH services that are confidential, accessible, acceptable to adolescent and young people. Climate change, environmental, and disaster risk reduction policies and programs must be developed and implemented with an intersectional, equitable lens and a human rights-based approach. This also means applying human rights, gender, and social justice-based approach to climate action that includes the full range of SRHR and to commit robust and feminist financing for the climate and SRH intersection. As CSOs, it's important to keep our advocacy efforts concerted and our network strengthened in order to highlight the synergies of the intersecting issues of climate crisis and SRHR to demand climate justice. And just in conclusion, the solution to climate crisis really requires bringing the SRHR agenda into the margins, from the margins to the center of the discourses. sustainable development and solutions to climate crisis cannot be achieved without universal access to sexual and reproductive health and rights.
Thanks, Deepu. The point on addressing structural inequalities, which include legal and policy barriers, is really important, but also how we engage with civil society and protect civil society in this space. And that was also discussed by Dr. Barry, is important. You all have given really rich perspectives, but maybe if I find a few common threads. One, in terms of priorities, one is really centering the voices of girls and women who are impacted the most in all levels of decision and policy making. This must be done in a human rights-based approach and a socially just framework. Also, how we engage civil society across different policies and planning. The second is how do we integrate health and climate in different policies and programs, whether in health policy, how do you recognize the impact of climate change, or integrate SRHR in climate adaptation and resilience strategies. That's at the national level, but also maybe at the global level, we can think of processes within the UNFCCC. Their gender action plan is coming up for review this year, and so how can we ensure that some of these issues are integrated as part of that review process. You've also spoken to making SRHR services a key component of strengthened and resilient health systems. And this includes access to family planning, maternal health, HIV and STI treatment and prevention. And also the challenge on financing. And I know there are some questions in the Q&A about that, so I'd like to dig into that a bit more. And finally, breaking down silos, and that's across the climate bubble and the health bubble, that's across ministries at the national level. And so, really trying to find innovative ways and strengthening the investment case. Dr. Adiko, you spoke to the importance of data. Really will help us strengthen the investment case towards that. We have a few minutes for Q&A, and my colleagues at FB 2030 are going to be helping me navigate that. So maybe we can discuss the question on financing, and maybe if Dr. Adigo, you would mind addressing that. There's a question on how do we address funding silos between development and humanitarian interventions to make sure those advance women's and girls' rights and access to SRHR, including family planning. Dr. Adigo, would you take that?
Oh, okay, yes. Sorry, I was hearing Dr. Adja. That's fine. Thank you so much. And so, yes, this is crucial because we all know that we are living in a world where there are so many demands and there are complex emergencies happening. And that is why we talk about that integration and systemic integration. So it's not simply about mixing and matching everything, but it's about making sure that we are able to leverage resources, and whatever impacts we have is synergistic on other areas that are of concern, right? And we know that investing in women and girls would give multiple benefits, also on the kind of issues that we are discussing. Therefore, it's important that financing is not vertical, because we do have some resources, but the challenge we see is we tend to focus on siloed products. And for instance, with the COVID pandemic, we diverted a lot of resources and investments that we had made in sexual and reproductive health into the COVID response. And then we ended up eroding the gains we had made earlier on in sexual and reproductive health. And so it's important that we sustain the gains by continually investing and taking into account that whatever we do should be done in a systematic way and integrated across the response. Thank you.
Thank you. I think that the ensuring that financing is not vertical and the continuity of providing some of these services across different crises just reinforces that importance. There's a question on culture, and maybe Bipu or Dr. Ajami Barry, we can address that. How do you increase SRHR and family planning to communities with strong taboos or who have strong cultural beliefs?
Do you want me to go first?
Sure.
Okay.
Merci.
So I think there are multiple
Oui,
ways.
merci beaucoup.
Sorry.
J'ai bien compris la question.
Thank you.
Effectivement,
It's true that in our context, there are a lot of taboos. We would come back to the multi-sectorial approach. This is work that needs to be done by multiple sectors, whether it's education, gender justice, human rights, young people, and especially civil society, to really do some advocacy work together. Advocacy for a lasting change of behavior and social norms. It's really what we do. We work in tandem with the various organizations and sectors, especially civil society, to really get there. It's very slow, this change, but we are able to get there progressively with this strong advocacy work. Thank you.
Thank you. Bipu?
So no, I actually was also going to say the same, that it requires that multi-pronged approach and multi-sectoral approach. But I would just add to what Dr. Berry has said is, like, there are also at the community level, what we can also do is to identify champions, or build champions or strengthen champions who the community would listen to. And there are multiple ways of also doing that, but also sensitizing media, and also is sharing information through media also has helped a lot in many of the works that we have done on the ground.
Great. There's a question, and I think it's directed to Gifty. You've mentioned the importance of data as one of the key actions. Is it possible to say more about data and evidence, the kinds of data is needed to support the intersections between climate justice and human rights-based SRHR?
Sorry, thank you so much. So we talk about data because we do have a lot of data all over the place. But it's important that we support countries to strengthen their national data systems and to enable evidence-based policy programs. Because without these data systems, and we cannot build evidence. And this requires investment. And so as we sustain investments in life-saving interventions, we need equal investments in data. And with UNFPA, we work with countries to look at the census. We are looking at innovative ways in which they can do small area estimates to look at where service delivery are, so that we can better target our efforts. And that is what we mean by investing in national data and systems. We have countries that have so much data, but this data is not disaggregated in ways that is useful. And so we work with them to ensure that there's also data for preparedness. And all these things must happen, as we said, through that development humanitarian continuum, so that we are better prepared with the relevant information to address the needs as they occur. Thanks.
Thank you. The continuum of data across the humanitarian development nexus is important, and we've also found that the focus on intersectionality and looking at the impacts of these interlinkages on girls and women based on different identities, like more work definitely also needs to be done there to make sure that policies and programmings are informed. I think we have one more question, and it's an interesting question for all the panelists. So welcome anybody who wants to respond. While the SRHR sector understands the importance of including it in climate policies as a rights and justice issue, some advocates in some settings have argued that family planning in particular does not advance rights because reducing fertility is a mitigation strategy. So what advocacy messages or value propositions would you share to address this point of view? How do we expand the conversation beyond, population control as a climate mitigation strategy? For anybody today.
So Divya, maybe I can start. I think there has to be this understanding that has to be built, and also shared, is that the contribution to climate crisis. I mean, the countries in the developing, it's not the population or the number of population that is deciding the climate crisis, right? Because the ones who are contributing the least to the carbon emission are affected the most, and they are targeted the most. So I think that narrative has to be shared widely, and in the language that everyone understands, and also sharing the knowledge and the evidences that the mitigation, using population control as a way of mitigating mitigation is a violation of sexual and reproductive health and rights, because it's and also it doesn't really respect the bodily autonomy of an individual, and it targets the women, and it all comes from this very patriarchal narrative of the control, and so this is something that I think we have to keep. This narrative is something that we have to keep sharing, and also, as I said earlier, in the language that everyone understands. Yeah, I'll stop there, but invite the rest.
Yes, I can also come in here to say that we know that when women and girls have agency and full autonomy, they are empowered and resilient and better able to cope and adapt to the inevitable crisis. And so when we talk about family planning, we are looking at issues of agency and full autonomy. And therefore, we want to invest in healthy and empowered women. And when we do this, it becomes a clear accelerator to build individual and community level resilience. And that is the narrative.
Thank you so much. We're at time. We're now, thank you to our panelists for a really rich discussion. We're now going to be moving to the next segment of the session, and it's my pleasure to invite you to join a conversation between Eric Bernardo, who's the FP 2030 Youth Focal Point for the Philippines, Dr. Sami Dube, who's the Executive Director of FP 2030, as well as Nesreen Talbi, who's the FP 2030's expert on emergency preparedness and response. They will unpack insights on FP 2030's refreshed emergency preparedness and response strategy and discuss the partnership's future priorities. Eric, over to you.
Thank you, Divya, and welcome to this on-air segment. It is my pleasure to kick off this discussion, which will focus on the emergency preparedness and response strategy. So first, let me go and ask Dr. Samu. We have learned a lot about the intersection of SRHR, climate, and emergency preparedness and resilience, thanks to the previous speakers. So for FP 2030 and its commitment makers, why is emergency preparedness and response important? Dr. Samu?
Thank you very much, Eric, and thank you to the previous speaker, Divya. Thank you for the panelists who at least they laid the ground for us. And a good morning, good afternoon, and a good evening to everyone around the room. So this is an exciting topic, Eric, in many ways than one. I believe that we have made the case for emergency preparedness and response. We've made the case for climate change, and statistics, they do speak to what we are trying to achieve. I think for me, even a reflection to the question that was asked in the last panel, this is about rights. So when the provision of SRHR care or in a crisis, in a crisis environment to any affected population. I think it comes down to us as a collective believing that people or women in particular have a right to reproductive health. More importantly, we are talking about a right to access to contraception, because that right is about when do I need it and when do I want it. And I think making it available in a time of crisis is even more important, because then there are many other things that that are beyond a woman's control. And for us as a collective to advance that particular right would go a long way. And that's why FP 2030, we believe that this is something that needs to be anchored squarely in our narrative going towards 2030. I also believe that, when we talk about women being, the treatment from harm that is caused by gender-based violence, especially the one that escalates in a time of crisis, it actually underscores the importance of us making sure that there is availability of family planning or even contraception when women need this. And again, we have seen in the statistics that are around us, perhaps even the narratives that we are experiencing worldwide, whether it's any region of the world. COVID has shown us that conflicts and wars, Eric, they are showing us the impact that a crisis would have in the rights of women and girls everywhere. And I think this impact for me, globally, it affects societal well-being. And we know that if we don't course correct now, we will actually even struggle later to catch up on those rights that have been lost, or on some of the nuances and gains that we could have gained if we are now starting to recalibrate or recover from those emergencies. COVID-19 pandemic is highlighting that squarely, and trying to deliver an early response is very challenging without us preparing that and planning for it intently. I believe, Eric, that for us as FP 2030, we have seen actually that countries that invest in emergency response, preparedness and response, they are better able to cope when there is a time of crisis, because you are building that margin, you are building that extra capacity for you to cope and even recover better and quicker. When you are not prepared, the economic contractions that we have seen for many countries, it's worse in countries that have never prepared for an emergency. And in that preparation, we know that SRHR, we need contraceptive methods for these countries to actually cope. As an organization, we started working on this strategy in 2018, and since then we have made major contributions to the global effort to increase access to family planning in crisis settings. And many countries since then are making, as part of their commitment, they are including EPR. And for me, I think that is an indicator that as a collective, as Gifty was saying within UNFPA, the data that is emerging from there, it should show us the direction of travel. Where should we go for us to actually emerge stronger after when a crisis has come and gone? And then lastly, Eric, I think what is important for us as FP 2030 in our new strategy is, are there any other players who we are not talking to? So when we are posing an EPR strategy and saying we are launching this, is because it's important for us in many ways than one. Who else is not in the room today who we need to speak to? I know that there are people in the private sector, there are people who are actually even, some of the issues around conflict and even climate change, they say, is deeply rooted around corruption that we see in our countries. So if we were to address that, preventative measures also need to be in the fore. And if we are to go in that space, Eric, who else should we be partnering with? That's why this is important for us as FP 2030. And if you recall, like in 2017, it was only Liberia who had made an explicit APR commitment. But between then and now, the number of countries has actually increased. So we are looking forward to us having a concerted effort to include this so that we can plan for a margin that will help us get there faster if we are working together. Thank you, Eric.
Thanks, Dr. Samu.
Maybe can I just, Nesrin, it's good to see you.
Thank you. It's good to see you too.
Fantastic. And as we continue this journey, maybe Eric, I will just continue and take over the mic because we want to discuss. I mean, Nesrin, to what I've just spoken about as part of the in terms of our transition, I think there are many things that have come to the fore around the importance of this journey. Now, the work around EPR for FP 2030, therefore, it has been a journey, and we're proud today that we are launching this strategy. So we want to continue building on our achievements and find ways to address the remaining challenges. Could you kindly explain to the audience what are the past lessons that we have learned around EPR and how these have actually shaped the FP 2030 EPR strategy, the journey so far, and what has informed this particular strategy, Nesrin?
Yes, thank you, Dr. Samu. Indeed, I mean, as part of the transition from FP 2020 to FP 2030, we consulted with a very wide range of stakeholders about FP 2030 future priorities. And this new EPR, Emergency Preparedness and Response Strategy, is really designed to align with the changes in the partnership's new architecture and its broadened focus, as it was discussed earlier. The strategy really reflects on 4 big lessons learned from the FP 2020 partnership. Firstly, according to the Informed Risk Index, which is a risk assessment for humanitarian crises and disasters, 71% of the FP 2020 commitment countries are highly prone to human-made crises and or disasters. And none actually of the FP 2020 commitment countries ranked as low or very low, so they all have a very important risk level. However, we saw that only 23% made commitments with specific EPR strategies. And as we collectively become more clearer about now what needs to be done, we are actually seeing more concrete EPR strategies incorporated into new commitments, as already mentioned in the opening and also by you, Dr. Samu, just before. Secondly, EPR efforts were previously viewed as the role of humanitarians only, but humanitarians are actually not always part of the technical working groups that develop national commitments, policies, plans, and budgets. We discussed a lot this silos approach as also in the previous panel. So governments and development actors really need to lead and fund preparedness with involvement of humanitarians to make sure preparedness and response actions align actually with globally recognized response standards and strategies. Thirdly, FP 2020 formed a strong partnership, we know that, with governments, donors, civil society organizations, and youth-led organizations. But maybe we miss a bit the opportunities to engage with other aligned actors. To correct this oversight and in recognition of the extreme threat posed by climate change to SRHR, FP 2030 is now trying to broaden its partnership base, including to environmental and climate change actors. And also partners have urged us to engage more with pandemic preparedness and disaster risk reduction actors, which are as important if we really want to have this holistic approach. And finally, from the lessons learned, we really saw that FP 2020 measurement framework lacked core EPR indicators. We really need to become better able to measure progress against EPR commitments now that we are also getting more and more in, and costed implementation plans to hold each other accountable for progress on meeting the SRHR needs of population affected by these crises.
Thank you so much, Nesrin. And that speaks to what Gifty was raising around data, underscoring the importance of data. And also it speaks to some of the lessons that, Dr. Berry was talking about in Burkina Faso around what they've learned. Also, it resonates very well, Nesrin. If I may ask, from these lessons that you've just narrated, what more do you think should be done to increase family planning access for women and girls affected by crises? And that, again, in your response, recall some of the questions that were asked earlier around the cultural issues that are a struggle, around the messaging, like what is that unique value proposition, etc. And then what do we need to do more to make sure that women and girls who need family planning have got access in a time of crisis?
So FP 2030's EPR goal really remains the same as in FP 2020's goal. What we really want is that family planning access is improved for women and adolescents affected by acute and protracted crises. But what the niche of FP it's in creating a collaboration platform for humanitarian and development actors to advance preparedness and resilience efforts at global and national level. And this is also including community-based organizations and all type of different actors that could play a role in strengthening this access to SRHR. And based on our progress and stakeholder input, the following, this EPR strategy outlines the following priorities. What we want to see is to continue support new EPR commitments from current, but also new governments and non-governmental actors, commitment makers. So we really want to see this EPR being reflected in the commitments because it also brings accountability around it. Also, what FP 2030 can do is broadband provide EPR technical and financial assistance to commitment makers, making countries via its regional hubs that will be soon established. So this new architecture of FP 2030, and also in collaboration with strong regional EPR actors, such as UNFPA. We know that UNFPA is a very big actor, the International Planned Parenthood Federation, IPPF, and also the Ouagadougou Partnership. And then we also want to engage youth and other civil society partners to develop an EPR advocacy and accountability agenda, where we could have IWAC at the global level and the CSO and youth-led organization at regional and national level. Also, what we want to continue is influence this global and national EPR agenda to make sure that EPR remains a focus, and also to see, it was discussed also about the funding and the silos, etc., the role we could maybe play in also bringing this information better to the different donors. And then also broaden the FP 2030 partner base and reduce these silos by fostering partnerships with climate adaptation, resilience, pandemic preparedness, and disaster risk management actors. And lastly, about data, we really want to develop and integrate an EPR measurements and also track progress to foster accountability on EPR commitments. So these are the big lines actually that are around this EPR strategy. And FP 2030 really wants to further facilitate this connection between diverse actors and the networks it has created actually since the 2020 partnership. And for instance, the focal points have been really instrumental for advancing advocacy efforts, commitment making, and accountability processes. And really with this regards, it would be really interesting to hear a bit more from country experience. And I would like to see a bit with you, Eric. So Eric, as a youth focal point from the Philippines, a country that is highly prone to natural disasters, how do you see this emergency preparedness and response strategy from FP 2030 advancing the work in your country?
Thank you, Nasreen. I think the new EPR strategy has clearly outlined the roles of FP 2030 and its partners at the global, regional, and national levels on how to push forward EPR and ensure that vulnerabilities of girls, women, and young people in crisis situations are minimized. Actually, the Philippines has a national policy on MIST since 2016, but I think a lot of work has still need to be done for its implementation. Responses with regards to emergencies are still very siloed, and there is still a lack of communication between those in the emergency and the health departments. The EPR strategy also clearly highlights the need to bring in development and humanitarian actors together, which in the Philippines would contribute to a more efficient response. And I think during emergencies, people need to know where they can access the services, and the quality of services provided at evacuation centers need to be scaled up. Actually, the Philippines, for the FP 2030 partnership, has made a commitment, and EPR is explicitly named in 2 objectives and mentioned or implied in several strategies. If I may just read one of this strategy, which links to the integration of universal healthcare, it should strengthen the collaboration and active participation of other national government agencies involved in national economic and social development, as well as in climate adaptation and emergency response preparedness. So this calls on the Socio-Economic Development Cluster Cabinet of the Cabinet Secretaries and the National Disaster Risk Reduction and Management Council. So I think that's how EPR is now being incorporated in the strategy or in the commitment of the Philippines. Thanks, Nasreen.
And thank you very much. And what are some, very briefly, can you say what could be key points you would like to share to improve the SRH preparedness and response in the Philippines?
I think as a youth focal point for FP 2030, I think young people should have an active role in EPR. They should not just be mere beneficiaries of the emergency preparedness and response, but they should be partners. They should be involved in planning and implementation of EPR as a strategy. And as CSO and youth-led organizations, as commitment makers of FP 2030, governments should also need to be held accountable of their commitments and implementation of their policies that support EPR. So I guess I'll turn over again to Dr. Samu now to briefly discuss how is the new regional structure going to help FP 2030 in implementing this EPR strategy and ensure that access to family planning in crisis, including climate crisis. Dr. Samu?
Thank you so much, Eric, for that. It's exciting for FP 2030 because even the announcement of the hubs that are going to be in Africa is just imminent. What that means is that we've got a new organizational architecture where we are going to be having 5 regional hubs, and these offices would work tirelessly to coordinate and make sure that the country-specific programs and activities are supported. Whilst that is obviously not going to be in each country, that has got a better reach for countries and yet remains globally connected. How we're going to organize is that technical capacity will be positioned in one of the new offices, and this will program for the whole of FP 2030. We will also continue to cultivate a strong network of partners who will advance EPR and bridge the divide between humanitarian and development actors, but also bring in new players into the mix so that we can accelerate the efforts that we are seeing around the room and create synergies at global and at a national level, Eric. Again, I think we are intentional about what we want to do around EPR. We are making conscious efforts to becoming better partners to civil society, and in particular, Eric, which would be of interest to you, youth-led organizations, that we can co-create solutions to the challenges that we are seeing. As you have alluded that, youth need to be part of the solution and not be spectators. And that means different things to different people. Youth, at times, they're in the front lines of SRHR advocacy. They are first responders, and even women are also, when a crisis hits their community, they should be able to hold duty bearers responsible for fulfilling their commitments. In the earlier panel, we spoke about women and girls as change agents, as leaders in this journey and in this fight. Therefore, it is important for us in this new architecture to ensure that partnerships are actually meaningful. It's not just engagement. It is real partnerships that are seeking to make measurable change. So when we can track back, years from now, we know that we've really made an impact. Again, these platforms such as CSW, we are grateful for it because the priority theme for this year is of highest importance. And FP 2030 recognizes the extreme threat that we see around us posed by conflict, posed by climate change, especially to populations already made vulnerable by natural disasters across the globe, and even infectious disease outbreaks as we are living in this state of an endemic COVID-19. So FP 2030 is expanding our emergency preparedness and response strategy to include a new focus on resilience at the health system, community, and individual level. In that concentric fashion, we know that that ecological framework would go far if we all can intentionally program and define what that means in our various constituencies so that we can be better able to deal with what is swelling around us, but also it's actually an army who are intentionally saying we need to halt some of the effects of climate change that we are seeing around our environments. We are also, as an organization, broadening our partner base to include environmental as you have said, biodiversity, climate change, and actors from across the globe. And we are advocating for EPR, for SRH to be included in the new FP 2030 commitment making process. I would also like to take this opportunity for me to thank all commitment makers. And in our expanded narrative of where FP 2030 is going, we would like to actually make sure that there are those who have not been making commitments. So initially it was like a focus on 69 countries, but now we are saying all countries ought to be engaged. So we would like to take this opportunity to thank all who are making concerted efforts around commitments that have included EPR, and this actually needs to be uploaded as we pause in that moment. There are, it's a number of 16 country commitments and partners working in the climate areas for their commitments, such as Margaret Pike Trust, Blue Ventures, PHE Ethiopia Consortium. These are intentional around what they can contribute to hold the effects of climate change, but more importantly, even responding in conflict and in disasters. Many of our partners sitting around the room, whether it's Women Deliver, UNFPA, our funders like FCDO, and they are going to speak later on, USAID, they are intentional about this because everybody is recognizing the importance of programming better so that we can create margin for when climate change disasters or conflicts actually arise. And lastly, I would like to encourage other actors such as, pandemic preparedness actors and disaster risk management actors to make FP 2030 commitments to jointly improve women and girls' access to high quality and rights-based family planning. Thank you so much, Eric. So perhaps now, could we, I don't know whether Chris has joined us Monday, could we actually ask FCDO, Chris Carter, to...
He's on the line.
Okay, thank you so much. Thank you so much. Over to you, Chris.
Yeah, and hopefully my camera is on. Oh, yes, it is, and you can see me. Thank you very much, Simon. I just want to thank everyone who's participated, all the panelists and the audience for a really wonderful discussion around the intersection of SRHR, emergency preparedness and climate resilience. It's so important that this is being discussed and that the right focus is going to this now. We know for sure that it's the poorest, it's the most vulnerable who will suffer the most from climate change. And it's women and girls who are often the ones in that group who suffer the most. Also from any crisis, any protracted crisis or humanitarian disaster. There's impacts on, and it magnifies unsafe abortion, unsafe pregnancy, increases maternal health. We've seen that again and again. So I really strongly welcome FP 2030's emergency preparedness and response strategy. And it was great to hear more all about that. And we'll be really focusing on that in the UK. Just to say a little bit more about the UK, I'm the Deputy Director for Human Development in the UK's Foreign, Commonwealth and Development Office. We are thinking very seriously about this. We have been for a long time a major donor and a leader on SRHR, and we will continue to be. The Foreign Secretary has announced and repeated announcement that we will restore funding to women and girls. So we will be increasing our funding. We also have been looking at, and part of my department have been looking at the impacts of climate change on health systems. And we had a major program, COP26, focus on that. We had over 50 countries who committed to not only decarbonize and have a carbon neutral health system, but also build resilience in health systems to climate change, but also other crises. And again, particularly in areas where there's a lot of fragility, conflict, and poverty. We have just launched a paper on ending preventable deaths of mothers, babies, and children, which discusses this, and also a paper on health system strengthening, which again will addresses some of the weaknesses that we and building resilience into health systems. So I hope you can see that the UK is an advocate, but also a strong ally in this endeavour. I just want to touch on some of the things that were mentioned, so that we really think about these. I think there are a number of things that came out strongly for me, and I won't mention everything, but we do need to keep up our investment. It's very important that we invest in resilience and emergency preparedness, and it's not just an add-on. We need to do much more around looking at preparedness and what more we can do to strengthen it. And the strategy is a part of that. Part of it, as we've heard, is around data, understanding what is happening on the ground, the lesson learning, so we know what to do. How do we strengthen preparedness? There are evidence gaps, but there is also a lot of learning that's going on and that we can incorporate. It's been mentioned, the advocacy that we need to continue to do, and this discussion is part of that. We need to keep up the advocacy. The accountability, I think, has been mentioned more than once. I really liked the discussion of partnerships, and Sammy, what you said, meaningful partnerships. It's not just a group of people coming in together in a room and agreeing with each other. It's actually breaking down the silos, as was said, and looking at increasing our impact by working across sectors and with partners we may not usually work with. That's the only way we are going to have an impact in this area. A couple of other things. FP 2030 has a major role to play. It reaches millions. I think it's well known that the UK is a strong advocate, but we just really want to stress how important that is. We also know that CSW 66, we're hoping for good outcomes. The draft conclusions actually have good recommendations that sort of reinforce the importance of SRHR and resilience to climate change, resilience to crisis. So hopefully we will see that. But I think I'll will end there. I think we do need to keep talking about this. This is not a flash in a pan type issue that we can talk about once. These type of events need to continue. It's how we keep the accountability up. And this is a long-term endeavor. This is not an easy area to address. But if we work together, we work in those partnerships, we can do it. Thank you very much. What a wonderful session. Thank you.
Thank you, Chris, for your closing remarks and for the UK's leadership on this aspect, and welcome news on restoring funding to girls and women. I just want to thank everybody for taking the time to be part of this session. Thank you to our hosts, FP 2030, as well as ARROW, UNFPA, FCDO, the government of Burkina Faso, Eric, Nesreen, and Women Deliver. I just want to end by reiterating that FP 2030 is still accepting commitments from countries, non-governmental actors, including donors, women's rights organizations, youth groups, civil society, including those outside the health sector, so environment and biodiversity groups. And we'll be sending the event recording as well as the microsite and resources shared and discussed today in the coming days by email. Have a wonderful rest of your day. Thank you.